Welcome to Med Madness, the podcast where we delve deep into medical topics and provide insights to help you excel in your medical journey. I'm your host, and today we're going to discuss a critical aspect of prenatal care, the screening for autosomal recessive diseases, with a special focus on Tay-Sachs disease. Prenatal screening for a variety of diseases has become a cornerstone of routine prenatal care. This screening is crucial not only for disease detection, but also for reproductive planning. The approach to prenatal screening is often determined by the prevalence of the disease, its impact on quality of life, and whether there are interventions available to manage or treat the condition. Tay-Sachs disease is one such condition where carrier screening is frequently performed. Tay-Sachs disease is caused by a deficiency in the hexosaminidase A enzyme, leading to progressive neurodegeneration and early childhood death. Given its autosomal recessive inheritance pattern, both parents must contribute one abnormal gene allele for the child to be affected. If a mother tests positive for a pathogenic variant in an autosomal recessive condition like Tay-Sachs, there is a 50% chance that she will pass her abnormal allele to her child. However, this does not mean the child will automatically be affected, which is in contrast to autosomal dominant diseases. So what is the best next step after a mother tests positive for a pathogenic variant? The answer lies in evaluating the father. If the father does not carry any abnormal variants, the child has no chance of inheriting the disease. On the other hand, if the father is a carrier, the child has a 50% chance of being a carrier, a 25% chance of having no abnormal alleles, and a 25% chance of inheriting the disease. This step is crucial in determining the child's inheritance risk. The screening process can be broken down into a few steps. First, maternal genetic screening is performed. If the results are negative, no additional testing is required, as the risk for disease in the child is low. If the results are positive, paternal genetic screening is the next step. Again, if the father's results are negative, no additional testing is needed. However, if both parents are carriers, definitive fetal testing through chorionic villus sampling or amniocentesis is conducted. This invasive testing provides a clear diagnosis, determining whether the child will be affected by the disease. Let's talk about the testing methods. Tay-Sachs disease screening can be done either through DNA sequencing or biochemical analysis, measuring hexa enzyme activity. If the mother has already undergone DNA sequencing, repeating the screening with enzyme activity levels is unnecessary. Carrier screening is offered to all patients based on carrier frequencies and family history, which allows for informed reproductive planning. Remember, autosomal recessive disorders like Tay-Sachs require abnormal gene variants in both parents for the child to inherit the disease. Thus, testing the father after a positive result in the mother is the next logical step in assessing the child's risk. Now, let's illustrate this with a real-life case study. A couple, Sarah and Mark, both in their early 30s, decided to start a family. Sarah underwent routine prenatal screening and was found to be a carrier of the Tay-Sachs gene. Understandably concerned, they followed the recommended protocol and had Mark tested. Fortunately, Mark's results came back negative, indicating he was not a carrier of the Tay-Sachs gene. This news brought immense relief, as it meant their future child would not inherit Tay-Sachs disease. Sarah and Mark's story underscores the importance of genetic screening and the peace of mind it can provide to expecting parents. It highlights how prenatal screening protocols are designed not only to identify risks, but also to reassure families about their reproductive choices. And that brings us to the end of today's episode. Prenatal screening for autosomal recessive diseases such as Tay-Sachs is an essential aspect of modern prenatal care. It empowers parents with the information needed to make informed decisions and helps ensure the best possible outcomes for their children. Thank you for joining us on Med Madness. Stay tuned for our next episode, where we'll continue to explore more medical insights to aid your journey. Until next time, stay curious and stay informed. This is Med Madness signing off.